Thank you, Mr. Chairman. Is that all right?
Yes, thank you.
My name is Richard Clegg, and I come from a small town. We've heard from the big towns, but I come from a small town called Tottenham, which is the closest town, the geographical centre of the state. But right now, the town that I represent has a very serious problem regarding the delivery of health and medical services. I know there are other towns with similar problems, but I'm optimistic about how we might be able to resolve the problem. I'd just like to take a short time to give a background to the problem. As an isolated rural town that serves a large district, Tottenham has managed to maintain a reasonably stable town population, but as is the case in most farming regions, the on-farm population has dramatically declined due to technology, larger equipment and financial constraints. Therefore, it has become increasingly difficult just to maintain essential services, which include, of course, health, law and order, education and other services. Of all essential services, there is none more important than health. Tottenham has always managed to support and benefit from the services of a full-time doctor, that is, until recent times, with doctor medical services for the last approximate 2 years averaging 2 days per week. I must add that Western local health district is endeavouring to provide a full-time doctor, but as we know, it is very difficult. Tottenham has to some degree defied the trend by remaining proactive and continuing to improve and add to its community facilities. The reason is simply our semi-isolation, and it keeps the community together. We have amazing community unity. For example, we have a very fine near-new MPS facility, a quality modern open living house for the doctor, a new substantial sports clubhouse supporting the sporting complex and school, and in the last few months, Tottenham community alone has contributed well over $200,000 plus labour and equipment to upgrade our inadequate gravel airport by erecting a new marsupial fence, installing 24/7 CASAR solar approved lighting, lengthened the strip, and just this week the strip has been completely sealed. The Lachlan Shire Council have been tremendously supportive with money and expertise and equipment. A truly magnificent achievement. But without a full-time doctor, our new hospital is and will continue to be increasingly underutilised. Staff will leave. People, even locals, will no longer retire to our town.
So the problem is sort of shared by so many smaller units. I think Lynn is actually working. You want to answer that? Or Robin? Yep.
Could I just briefly, Mr. Chairman, summarise in what I believe could be a solution?
Thank you. Solutions are better than problems.
Yes, well, I need to outline the background so you understand. But this in turn puts pressure on beds and services elsewhere, as we all know. I'm sure there's no need to reiterate that. In the meantime, our town will decline dramatically and will never recover, which would be tragic. Therefore, it's vitally important for the state's health services, for all concerned, to do whatever we can. So our number one, number two and number three priority for our community is a full-time doctor. So to finish on a positive note, in order to hopefully find some solution, I believe the solution for doctor recruitment for towns like Tottenham is clever marketing, and I'm suggesting this might include, I've got 3 or 4 bullet points. Develop a quality professional marketing program to target prospective doctors, highlighting the town's facilities, services, lifestyle, and especially what can be very lucrative financial benefits, and promote more effectively in appropriate publications, promote through selected social media. For example, 800 to 900 million people look at Facebook every day. That apparently many professionals are leaving countries with crumbling economies. We need somehow to effectively tap into this existing pool, target overseas doctors more aggressively and do everything possible to make Australia more appealing, establish a recruitment fund to develop a marketing program tailor-made for individual towns. I'm almost finished, Mr. Chairman. Main stakeholders could be not only the government and district health, but local shires and even communities, and discuss the merits of a minimum guaranteed income where appropriate, because the business has run down. We need to somehow get and we need to work closely with representatives from our communities. And thank you for the opportunity.
Thank you. Yeah, thank you for that. I very much agree with a lot of what you said regarding recruitment. We do have to think outside the square, and the Local Health District Board is very, very aware that workforce is probably our biggest problem, because unless you've got workforce in the way of doctors, allied health, nurses, all of these people we need to provide services. I'm a director, one of my other hats is I'm a director and former chair of the New South Wales Rural Doctors Network, which is a workforce organisation funded by the state government. And we are constantly looking for new ways to try and improve recruitment, and are now expanding that organisations into allied health and nursing. So I take a lot of what you said on board, and I certainly would be happy to take your comments to the Rural Doctors Network. I think we as a district board will be working much closer with both the Medicare locals and the RDN in order to make sure that we try and get more people over the Great Divide. I actually left a crumbling economy in Wales before it started to crumble, but I feel very strongly that we don't really market the advantages of living in rural New South Wales, not only to overseas trained doctors, but also to Australian graduates. And we really need to try and improve their opportunities to come out bush. And I think in particular, and that's something that's very close to Joe's heart, I know, is we've got to try and get more training for specialists out here as well, because if you get them out here and they realise what a great lifestyle and what opportunities there are clinically, they're more likely to stay. So it's a really broad spectrum that we've got to hit, but workforce is very, very important in the board's thoughts. Thank you.